everything. Just do something. Pick one thing, something that's close to your heart, and do it. Whether it's writing a letter, going to visiting someone who's sick at home, whether it's collecting money from one of your staff members. I was told this morning that the P2P staff donated blood for one of their team. That's a wonderful thing to do. Makes you feel good. So donating, being part of a group, getting yourself involved, getting passionate about something. Do something. Make yourself feel good. The country will feel better. T. T is kind of obvious for me, maybe not for you, but T means to me think. Think about what you're doing. Think about your job. Think about your family. What are your goals? Think about what you want. Take a picture of them, put them up there somewhere. And every time you're feeling low, you think of the things that make you feel better, that are going to make your life better, easier, that's going to make your family better. Thinking about all these things and putting it together in a coherent plan is what will make Digital India succeed. It's not the country, it's you. What can you do? A. A is to allow and activate. Allow other people's feelings to be out there. You're not the only person who has an idea over a controversial issue. Let other people feel what they want, be what they want, do what they want, without you getting involved. I told you, no, that's not positive. Let other people be free to practice their religion, to practice their sexuality, to practice their political ideas, to practice their leisure activities. Let them be free. Free yourself. Activate yourself. Let the world seep in and think about what's happening around you without pointing a finger at people who you don't agree with or you don't like or seem to be too far out for you. That's important. Stay neutral. You can have your own prejudices. You can have your own feelings, but you don't have to show them in a way that's negative to other people. That's an important thing. L, I couldn't think of an L this morning, so I corralled my daughter at breakfast. Give me some words that start with L. And she said, live well. Okay. I was going to say love, but that kind of gets tired. Live well. Eat nicely. Buy the clothes you like. Go for a day trip. Treat your children. Give your wife an extra hug. Make sure you remember her birthday. Send your friend a card. All the things that make life pleasant. Live well. Take care of yourself. Exercise. Eat proper food. Be happy with your day. How lucky you are to be here. Here we are. There are people that can't eat, and you're sitting in this beautiful air-conditioned auditorium with a job, friends around you, team members, all of whom are supportive. Be grateful. And that's living well. Be grateful. Be thankful for what you have. Tell every day to God or to whoever, thank you so much for what I have. I'm going to give to show my appreciation. Next one is I for India. Lots of I's. And I chose the word indulge. Indulge yourself. You want to go to a movie and have a snack on Sunday? Do it. Don't say I can't afford. Next week, next year, too old, I'm too young, this person won't like it. Do it. You want to take a trip that seems extraordinary? Plan for it. It might take a year. You might have to save for 2 years. Or maybe it's next week. Do it. Make sure you take care of yourself first. You want something nice, special to eat? Do it. Go to the store, buy it, bring it home to your wife, cook it, or your parent, or whoever. Take care of yourself. Do things that make you feel good. Do things that make you feel happy. Digital India will be better as a result. I couldn't do N. I asked credentialing, they couldn't give me N. I asked call center, nobody could give me an N word. I looked on the net, there are 200 words. I couldn't find one good word for N. So I came up with this one, nationalism. And I think nationalism is part of Digital India because it needs for you to care about your country and yourself to register and be a part of the movement. If you don't do it, it won't succeed. Do it. There's many instructions on the net. I looked this morning. YouTube, how to register, what is Digital India? Just spend a few moments to take the pieces out of the program that are meaningful for you. How is this going to help you? Maybe you're tired of carrying those medical records. I see people in RxDX with a folder. They lose it. They can't remember what medicine they took 3 years ago. They had an operation, but they don't remember the doctor. All these things can be put into a nice digital locker, which I've left for someone else to discuss. What is the digital locker? That's part of Digital India. It'll make your life easier. You won't have to go hunting back to that school in northern Bombay for your high school diploma that you can't find because you lost it. And you need it for this job interview. And it's nowhere to be found. With the digital locker, it'll be there. Everything you need will be there. There are many components to it. And I won't get into the technical components. I'll leave it for the other speakers. But I'm sure medical records is one of it. Academic records is part of it. Immigration, passport, part of it. If it actually happens, it would make papers almost obsolete. So that's one of the things Digital India pushes for is documentation. So that was nationalism. Digital India. Is incentive. So you say to yourself, why should I do this? What am I doing sitting here? They want me to put something on the net with my Aadhaar card. I don't know how many of you are registered. How many of you are registered? Raise your hand if you have an Aadhaar number. How many? Yeah. Very good percent, maybe 80, 90%. That's all you need. You have your number. You can go online, figure it out first, register yourself. Then tell us when we have our next, I'll register myself. This is what I learned. This was a positive. This was a negative. Have an input. Tell us what it meant to you. How hard was it? How easy was it? Do you need help? Just do it. Did I say I for incentive or no? Did I say I? Okay, I'm on the last one. The last one is a quote. It's not unique to me, but it's certainly common all over the world. And that was this. When John Kennedy became US president in 1964, he had a very famous inauguration speech. He also had a very famous poet read, Robert Frost, The Path Not Taken. That was interesting, considering reading that poem to you. But I decided simply to give you a quote that certainly, I'm sure you've heard it before. John F. Kennedy said, this is the A, ask not what your country can do for you. Ask what you can do for your country. So I say to you this morning, ask not what India can do for you. Ask, what can you do for India? What can I do for India? Ask yourself. That's the way the country will prosper and grow. And this scheme will be implemented. If each person does one thing, it will be successful. So with that, I bid you adieu from me. Any questions before we move on to the next speaker? Questions? No? Thank you.
Thank you, Ms. Madam. Light is considered as a symbol of auspicious prosperity and abundance. It brings brightness with it and removes the darkness. So I request Dr. Kalyanpur and all the distinguished speakers to light the lamp of knowledge. Please take your seat. Thank you. I'm delightful to address our Chief Radiologist and CEO, Dr. Kalyanpur, to address the group.
Good morning and welcome to this event. I'd like to congratulate the team for putting it together. And I wanted to say that from our perspective here in Teleradiology Solutions, we're absolutely delighted by the concept of Digital India Week. I think it's an extremely powerful and potent concept, one that uh, potentially can ignite this whole force of digitizing the country and empowering our citizens to be digital citizens. And I say this from a perspective which is a very focused niche perspective of healthcare in IT. When we started Teleradiology Solutions in 2002, uh, we were a very small organization and we had a very specific purpose, which was to report scans that were digitally sent to us from hospitals around the world. And today, 14 years later, we have reported over 3 million scans for over 100 hospitals in over 20 countries. So, we're very excited about Digital India because we have, for the last decade and a half been, and I would like to say this with all humility, at the forefront of digital healthcare. Our vision has been to produce an experience for the healthcare consumer, a virtual experience that is in every way equal to the real experience. And we started with radiology, which is a field where digital imaging has really transformed radiology because it has allowed us to report scans in a very, very short period of time. Scans done in emergency situations, we're able to report within a few minutes. A scan done in a different part of the world, in a remote part of northeastern India, in a place like Arunachal Pradesh, which has no radiologist. We routinely report scans within a few minutes, and we're able to deliver an immediate diagnosis, which allows for immediate treatment. So there's tremendous power in this concept. It's able to address physician shortages. We have a crippling shortage of radiologists in our country. We have only 10,000 radiologists for a population of 1 billion. So the only way to utilize these radiologists effectively is by employing teleradiology and digital radiology. So Digital India has the potential to take this to a whole new level. Um, the other thing that teleradiology does is it lowers the costs of healthcare. And as we see across the world, even in the developing world, the cost of healthcare is becoming the critical point. And by curtailing this at the very outset here in India, I think we can have a more robust healthcare system which does not end up sucking in the rupees. Starting with teleradiology, we have since evolved into several other entities, which include uh, Telerad Tech, which is you can hear a presentation about the workflow platform which we've developed in-house that allows us to empower all radiologists anywhere in the world to report scans efficiently and productively. So technology development for the purpose of telemedicine is also a very key part of our vision. We have developed e-learning tools which allow us to train radiologists and pediatric cardiologists across the country, across the world, and because ultimately the only solution to physician shortages is to train more physicians. Technology is only an enabler for that. And we've developed an entity which works with clinical research organizations to do analysis of uh, scans for drug discovery and accelerate the process of drug discovery. It's called Image Collab. Uh, we've done several initiatives in telemedicine. I'm sure Dr. Chavi will talk about them, where we are able to provide healthcare at the level of the primary healthcare center with specialty coverage being provided. And most recently, we've developed a venture in clinical psychiatry, which is a virtual entity which allows for virtual consultations. Nikita will be telling you about that. So we, as an organization, we are very much on the cusp of digital medicine and telemedicine, and we are at the horizon of where healthcare and information technology lead. So Digital India Week for us is an extremely important event, and I'm very happy to be here to share this moment with you. Thank you very much.
Thank you, sir. It is now my pleasure to call upon Mr. Venu to speak on Switch Digital India.
Yeah, good morning everyone. So today I'll be talking about the digital India and more precisely about the healthcare perspective of the digital India. So the previous speakers have already talked about the digital India is to empower the people to access the digital services. So when we talk about the healthcare, so it's a digital healthcare services that will be provided for the people, right? So the digital revolution for the healthcare has been existing over the past few decades, and so it's the IT is what you call over the recent years it's been adopting to the healthcare. So I'll just give you a glimpse of what we are doing as part of the healthcare digital services. So let's just have a look at about the conventional or the non-digital radiology workflow, how it used to work, or is a paper-based workflow. So let's say a patient walked into a referring physician or a doctor, and the doctor requests for an order or a scan, right? So in the olden days, where there is no digitization in the radiology is existing, so what a doctor do is he'll prescribe a scan, right? What needs to be done, and the patient takes the prescription and he moves on to the hospital wherein admin will schedules or creates an order for it. Again, there is a paperwork involved, and then the patient arrives to the hospital and he produces these reports or the prescriptions. So the technologist, depending on the prescription, he'll schedule the relevant exam protocols, and then the scan will be performed on the modality. And the output of the scan can again either be a film, like a plain X-ray film, or even the hard printout of the CT or the MR images. So the patient then picks up these reports or the images and then walks into the radiologist, wherein the radiologist will look at these plain films and then provide his diagnosis on top of that. And again, another paperwork wherein he has to write the report and then sign the report. So the patient has to take these images and the reports back to the referring physician, wherein he'll prescribe the next course of action. So if you see here, there is a lot of paperwork involved. On top of that, there is a lot of coordination that needs to be done from a department to department, right from the beginning of the workflow, wherein the doctor raises the order, right back to the report generation, right? So let's see how the digitization will overcome this. So this is how a digital radiology workflow looks like. So let's say again, here I took the, what do you call, here I just took an example of the ER and as well as an elective order. So as soon as a patient walks in, the registration will be done in a system called as a healthcare information system, which we all might be aware of, right? In the HIS, the order will be raised or digitally, which is on a system, and that will be sent to a RIS, which is a radiology information system. In radiology information system, the information is exchanged, and in the RIS, the order is created. So from RIS, the inside the hospital, the modalities keep querying the RIS system, like whether any procedures are there or not. So the again the information is automatically exchanged to the modality. So modality knows what scan has to be performed, and then the scheduled procedure it will automatically pick, and the exam protocol will be picked automatically. The scan is performed. As soon as the scan is performed, the modality will inform back to RIS saying that hey, the acquisition is completed, and it will also intimate the PACS saying that images are already completed and acquired. All right. Also, one more thing is, as soon as the patient is scheduled for scan, the RIS can communicate back to here if you see the PACS. So that what happens, the PACS will prefetch any of the prior exams that were relevant for that patient, and those priors will be retrieved so beforehand. And once the scan is completed, the images will be pushed to a diagnostic workstation wherein the radiologist will perform the diagnosis and then report it. So the report goes back to the report repository, and the repository from there it can be sent back to the HIS, right? So again, the referring physician has access to the report, and he can now look into the report and again suggest the next course of action, right? So one thing we can notice here is there are multiple systems and subsystems involved here, and they're talking to each other. There is no involvement of a person or a paper, right? So in order to achieve this, there are certain preconditions. So let's see what they are. And there are certain regulations and the interoperability. So when two systems or subsystems talk to each other, it's very important that there is a standard of communication, and the standard is predefined, right? So and the information that is exchanged, it could be either the administrative or a clinical information, or it can even be the images, right? So to address this, there are certain standards like DICOM. DICOM primarily focuses on the images, how the images should be written and how the images should be formatted, and how the modalities or the different healthcare information systems should talk to each other with respect to the images. And now the other one is the HL7. So in the HL7, the mainly the clinical and the administrative data, such as how the order should be created, how the report should be transferred. So that is what is been administered by the HL7 standard. And of late, there is another standard which is coming up, which is the XDS. So what XDS says is that across different enterprises, since we have both the image and the non-image data, So this is a cross-document enterprise standard, which says that it should be agnostic of the information that can be transferred across the systems, right? So XDS make use of both the DICOM and HL7 and other already established standards. And now coming to the security, obviously, when two systems are talking to each other, the patient information is being exchanged. And it's very important that the security and the efficiency of this patient information is maintained. So HIPAA imposes certain restrictions of what data that can be transferred and how it should be encrypted or secured, be transferred between the two subsystems. Now comes the regulatory boards. So if someone is developing a product for the software, let's say it could be a healthcare information system or a radiology information system. So it should be adhered to certain norm levels, and it should be categorized at what risk or hazard can it cause to the patient. So these regulatory boards like FDA, ISO, and CE, so what they do is they evaluate the product based on the criticality and they categorize the product like class 1, 2, 3, depending on different what you call policies, right? And then now that we see so many standards exist here, so there is a what you call an initiative taken by the healthcare professionals, which is called as a IHE. So what IHE says is that how the standards should be implemented and how the system should coordinate in order to achieve a very efficient workflow, and the system should be performant enough. So let's see what today we have in the Telerad Tech, which caters these digital services. So on the top we have the RASPA, which is a radiology workflow system, and it takes care of both the risk packs and the other parts of communication to the HAS. And the other one is the cardiospa. So as we know, there are different ologies in a hospital like radiology, cardiology, oncology, and your packs and the system or the workflow should be tailored enough to meet each of these requirements, right? So the cardiospa is again a variant of RASPA, which is catered to the cardiologist requirements. And the next one is the distribution of the data. So once you have the images and reports, so how do patients access these images and reports? So that is the connected imaging, so which enables seamless access to these digital records for the patients, physicians, radiologists, and to the hospitals. So as we see that there are many systems involved, many people involved here, so, and many actors are there. So there is a need for the efficient collaboration system. So that's what the V-Health or the telemedicine, the platform, what it enables is it gives you a way to enable both the video, audio chats between different actors like patients, physicians, and the specialists. It also enables any device that produces what you call audio input or video input, such as a demoscope or even a digital stethoscope, so that information can be transmitted across to the physician. So it's a remote medicine or a teleconsultation product. And since we have the abundance of the data available, the other challenge is the mobility. So how do you bring the data onto the different form factors? The form factors are like it could be a mobile workstation or even an iPad. So your data has to be mobile enough so that every user can have the access to this data. So that's what mobile RASPA gives you. And the other one is a dental spa. The dental spa is catered around the dental workflow, and we have vet spa for the veterinary users or the veterinary radiologists. And we also have a RASPA disk burner, wherein some patients might want a what do you call a CD on the hand, even though we enable the distribution of through the connected imaging. So to do that, we integrate with the what you call robot disk burners, wherein a hospital can have a robot disk as the patient walks in. Once the scan is done, the disk can be burnt along with the reports and the images. And we also ventured into the telepathology, wherein the slides can be digitized and they can be sent to the remote for a remote reading for the pathologist, right? So this is how the digital trend looks like. So it all started with the paperless, the filmless, and then the mobility, the access of the information anywhere and everywhere. And of late there is a buzz around the meaningful use. So what is meaningful use? So any HIS systems or the EHR providers, so the US government, they have a structure for the electronic healthcare record. So as long as the products meet the structure, then your product will be attested as a meaningful use. So what is the benefit of meaningful use? So any product, any hospital which is employing the products which are certified as a meaningful use, then there are certain monetary benefits. And on the flip side, if you are not compliant, then there will be some penalties as well. And now with the abundance of the data available in the healthcare, right, be it from the images, the administrative, the reports, the metadata, everything, so obviously the next big thing is the analytics. So what analytics do is like it churns out the data and then it presents to various users again. It could be a business analytics or a clinical analytics or even the image analytics. So when I say image analytics, so the software can actually read the image and the software can be trained to identify the anomalies in the data and then it can add like as a precursor or a preliminary report generator. And so the trend is again moving from the diagnosis to the prognosis, right? So having said this, I conclude my talk and would be happy to take any questions.
Thank you, Mr. Venu, for your delighted knowledge.
Yeah.
We would now like to hear from Ms. Ankita on information and communication technology in mental health. Tara?
Hi, everybody. Today I'm going to talk to you about healthy minds and how we've used technology to tackle the big challenge of mental health care in India and also the world. I'm not quite sure how many of you have seen statistics around mental health care in India. Let me just give you some perspective. If you haven't seen these statistics, it may just blow your mind. It definitely did to me. Did you know that WHO says that India is the most depressed country in the world? 36% of Indians suffer from clinical depression at some point in their lives. 1 in 5 individuals have a mental health care disorder. This is by a Government of India study. Suicide is one of the leading causes of death. India has the most number of suicides in the world. Very unfortunate. About 500 people die from suicides every day in India. And these are just some of the statistics. The sad problem is that with these statistics, there's still no large platform tackling mental health care in India. And this is what we at Healthy Minds set out to do. And how did we set out to do this? By using technology. Technology is something that allows us to use a digital platform to allow convenience, ease of access, and make things much more affordable, bringing a lot of efficiencies into the entire system. The three big reasons where India lacks in terms of access to mental health care is one, lack of awareness. Most people in India don't really know about all the mental health care disorders. I'm not quite sure how many people in the audience would know something about borderline personality disorder. What exactly that is. Schizophrenia. That's still a little bit more mainstream, but mental health care is just one big black box that no one really knows about unless it really directly affects them. And even then, it's very tough for people to diagnose. The second thing is the stigma, which is unfortunate. People may understand that they have depression, but they don't want to reach out because what if someone finds out? What will their friends think of them? What will their family think of them? And unfortunately, this social stigma is a huge obstacle for people to reach out for help. The third thing is access. I may have depression. I may be over the stigma. I'm okay to reach out for help. But who do I go to? Do I go to a counselor? Do I go to a psychiatrist? Do I go to a psychologist? There's so many options that I don't even know who's good, who's not good. So there's no real access or ease of access. You don't want to talk to your friends. You don't want to ask someone, hey, do you know a good doctor for depression? It's something that people don't talk about. And so people generally look online. And currently online, there's no single go-to platform for mental health care. And so at Healthy Minds, we set out to be the go-to platform for emotional and mental health care. So if you log on to Healthy Minds, it's very simple. All you need is a laptop. You can go to www.healthyminds.com. What it allows you to do is not just discover mental health care professionals across different areas for depression, stress, anxiety, relationship troubles. It's a huge gamut of concerns that we tackle, and we have experts across the different areas of concerns. Not just are you able to discover the mental health care professional, but you're also able to look at their profile. You're also able to book a session with them. You're able to pay for it online. And the best part of it is that you can actually have a video consultation in the comfort of your own home. And this is really amazing, and this completely is a game changer in the way mental health care delivery happens, not just in India, but around the world. Uh, Telepsychiatry is still quite nascent across the world, and in India, we're catching up very quickly. Healthy Minds was the first platform in India to actually deliver video consultations, a platform, an end-to-end platform to do this in India. And I'm going to talk a little bit about the technology, since this is about Digital India and the use of ICT. So I'll delve into the technology and how we really built this right here. So just an overview of the technology. There's no downloads. It works on low bandwidths. All client data is extremely secure. It's built on HIPAA, so therefore there's complete patient anonymity, and we keep all the data extremely private, extremely secure, because psychology and counseling, there's very personal information. So we actually go a long way into making sure the data is very secure. The other thing is that it's on the cloud. So this is what allows people to really access it from anywhere and everywhere. So we made it really attractive, easy to use. Just to step back a little bit, we actually spent a lot of time talking to psychiatrists, psychologists, counselors, especially in RxCX. We spoke to a lot of people and understood how the offline setting of counseling worked. And so we actually built a lot of that into the online system. And plus, we brought a lot more efficiencies into it. For example, a lot of the intake sessions happened in the first session. We thought, why not just have the intake session in the matter of a form that people could fill out before the session, and a counselor could read prior to the session, so that the efficacy of the actual session was much more efficient and much higher. So we looked at efficiencies like these, and I'll talk more about that in the next few slides. But this was key to make it really attractive, easy to use, because this is a B2C model. So you'd have individuals like you and me accessing this from their laptop. So it had to be super intuitive for that to be a success. So this is what it looks like in terms of, if you wanted to look at the profile of Dr. Sandeep Deshpande, a psychiatrist, it's completely transparent. So you can see his approach to counseling. You can see his specialization. You can see what are the age groups he targets, what are the areas of consulting, his education, his experience, any certifications, any registrations. And this is amazing because a lot of times when we go and speak to a doctor, we don't even know what their certifications are or what their experiences are. And so this platform allows everything to be completely transparent. Help in choosing your expert. Like I mentioned, a lot of times you don't know who to see, right? You know you have depression, but who's the right person to see? And so here you can actually choose. You can say, I have depression. I'm more comfortable speaking with a female doctor. I'm more comfortable if he or she can talk in my local language. And so you have all these filters that you can actually use to get the right expert that you're comfortable in talking to. It's a super easy appointment booking. This is what it looks like. It's one click and you can book your appointment. Every individual has their own dashboard. So as a new registration, you get this completely free. We also provide a dashboard for all the doctors and mental health care professionals. And it's basically a free practice management system because here they can, you look at the dashboard, they can see patient profiles, they can see the intake forms that the patients have filled out. They can interact with their patients through a messaging system. They have notes and reports that can be sent out to patients. And so notes will help them for their next session so that they can quickly refer their notes so that the next session happens completely seamlessly, which in the offline setting is very different because a patient may come back after 2 months and they're still trying to remember, okay, what did that patient come up with? They have to go through a whole number of files and papers just to get some amount of history on that patient. And so we built a lot of these efficiencies into the system to make it completely efficient and seamless and easy for both the professional and the user. And of course there's a play button out here, this little play button. So every time you book a session, it'll come up on your dashboard, the appointment booking. This play button activates 5 minutes before the session. All you have to do is click on it, a video screen pops up, and you're instantly connected with your counselor on the other end. And it's really amazing because it's really revolutionary, the technology. It's still in its early stages, but so far the feedback we've got has been great. A lot of individuals using. So right now we have people from across India already using the platform. We are connecting people who are who may be in Nagpur, who are looking out for a psychiatrist, who may not be able to find in their area. We're able to connect with people who want to have sessions at 9:30 at night because that's when they come home from work. The kids are tucked into bed, and that's when they really have their my time and they can focus on themselves. And in an offline setting, they can't go visit and have a 10 p.m. session in a clinic. It's just impossible. So this allows for a lot of that to happen, and essentially through technology, we're actually impacting people on a daily basis. People are more open to coming out because it's anonymous. They have the comfort that no one's going to know they're seeking help. They're benefiting from this. They're referring their friends onto the platform. People in small towns are reaching out because they're clearly searching online for solutions, and now they have one. They can instantly get connected to an expert anywhere in India. It's not limited by where they're living or their geography. They're instantly connected, and it doesn't even matter what time it is because that's the amazing part of technology. It brings access, convenience, and sometimes it also makes it more affordable. And we have assessments as well. There you can. So again, if you're not sure, if you need help, if you don't need help, you can take an assessment. We have assessments on anger, anxiety, and stress, different areas. You can take an assessment. We have built-in algorithms that can immediately tell you, where you stand on a scale of 1 to 10, and also identify who's the right expert you can speak to. So it's a completely integrated system. It's an end-to-end system we built in. We also built in a lot of content into the system, so we realized that awareness was a big part that we had to play a role in for mental health in India. So we actually wrote a lot of content, over 150 articles around everything from anger um, to stress to loneliness to ADD, and I think that's also a big mission for us, is to increase awareness, increase knowledge about mental health, make people understand that it's not a weakness to reach out for help. In fact, it's a huge strength. You're only building yourself and making your life, enriching your life, and making it much better. And I think that's what we're setting out to do with Healthy Minds. And technology is the backbone that we're using. Thank you. Any questions? I'd be happy to take.
Any questions? Thank you, Mr. Next speaker of the day is Mr. Ravi, who will enlighten us on information and communication technology in health.
Hello. Good morning, friends. It's a pleasure talking on this subject, especially in these exciting times with the Digital India campaign by our leader, Mr. Modi. And this is an exciting time because not only we have a great leader in India who is really driving all this, who has a big vision, but also the fact that he's supported ably by the great technology that we are having right now, in terms of whether it is devices, whether it is on the telecom, whether the supporting systems are also in place. And that's why perhaps this is one of the most exciting times as far as ICT is concerned. And I'm going to talk very particularly about ICT and healthcare. The speakers before me have spoken a good amount of, have given you a lot of information in terms of mental health and other things. But very specifically, I will talk about ICT in healthcare on a general broad terms. Before we talk about ICT, very quick definition. This is what the internet says in terms of an umbrella term that includes any communication device and things like that. But essentially, what I want to tell is data and information exchange is the center of all ICT systems. That is data and information exchange. These are the most important things of which is central to ICT. And as far as ICT in health is concerned, we call it health IT or health ICT. It is nothing but use of this information and communication technology in health and healthcare settings. Very simplifying this whole thing. Now, health is the goal, whereas the information, a meaningful information, is the value add that is helping reach that goal. And technology is nothing but a tool. So, getting value from your data, when the data is in place, the whole lot of things can be done. When you refer to analytics and things like that, will slightly take up going forward. But this is the building block actually. Data is a building block for all ICT systems. How does it look like in real life? Some forms of health ICT, essentially, I mean, all of you are familiar, most of us. HIS systems, HMS systems, EMR, PAC systems. Now with almost 60-70% of the population having mobile phones. M-Health is one of the main thing that is happening right now. On the mobile, you have different kind of applications that are supporting healthcare, including videocon. A lot of people are using WhatsApp for even sharing images and data and taking online consultations. You have laboratory information systems, we have telemedicines, radiology information system, health exchange to connect all disparate systems into one, and we have clinical decision support systems. So why do we need health ICT? That's a question that we need to ask at the very first place. Why not just stick onto the paper-based system or what we were doing traditionally years back? Because there is so much of information today available that it is very difficult to really get hold and streamline those information. So we need a channel, we need a tool, we need a mechanism to really streamline that information and make a meaningful a meaningful use of that information. And we have structured data that is coming from the applications, we have unstructured data that is coming from text messages, images, a whole lot of things. So health ICT, which was traditionally sticking to the structured data all this while, will probably also look at moving towards unstructured data and getting information out of it. Healthcare is also error prone and technology can help. You see, what happens is this is a matter of life and death. It's not some financial loss or it's not something that you can really live with. It's important that there's a whole lot of statistics available today that how many people die actually of clinical errors or human errors that happens in the hospitals and care setups. It could be a drug allergy that can kill. It could be drug-drug interaction. A whole lot of things that actually lead to errors. Because we need high quality patient information to improve care. Because doctors are not also fed with a whole lot of information because they are looking at so many patients. Probably they need information very quickly in a consolidated manner, and health ICT can really help in that way. Also, the fact that health systems, IT systems like HIS, LIS, it helps really set up standards and processes in the hospital or in a healthcare setup. Is important that we use health ICT because right now what happens, everybody does their own piece of work in their own manner, in their own way. This really brings in semblance, this really brings in a process improvement in the system. In fact, we, according to the statistics, only probably less than one doctor, about zero point 0.7 is available for 1,000 patients in India. And on that, it gets more complicated. It's just not that. Because most of the doctors are actually concentrated in urban areas, not rural areas. And 70% of our population lives in rural areas and semi-urban areas. So the access to healthcare, the access to quality healthcare is not there where majority of our population lives. And perhaps one of the reasons is that we are, if you look at the WHO statistics, we are the second largest uh, population of diabetes and many other diseases. And probably by 2030 it will overtake China with about 100 million diabetic people. And the whole lot of we probably contribute about 23% to so many diseases across the world. So access to healthcare is very important because at the prevention stage, the preventive stage, if we can really reach out to these population, it can really help, curb these on diseases at real onset. Some of the major applications of health ICT is basically main goal is to treat patients ultimately. But not only that, it can help because the data is concentrated. You can conduct research, you can educate your workforce, healthcare workforce. You can track diseases. You can have disease profiles. You can monitor the public health. And the value is, we need not talk about it. There's a whole lot of things that realizes. This slide probably will be very smaller space to put it, but there's a whole lot of value that you get from health IT implementations. Uh, so the question is basically in terms of what we have embarked on, digital India, how ICT can transform healthcare in India. That is the key question that we need to talk about. Uh, a couple of years back when I was really flying from Calcutta to Bangalore, I met a family, a very poor family coming from Assam, and they essentially, the lady had some heart problems, and I asked them, okay, where are you going? So they said they want to go to Narayana Hrudayalaya, and the flight was late, and it was almost midnight, 12 o'clock, and they didn't have clue about how the Bangalore looks like, where they have to go, which hotel. So I asked, is somebody treating you in Narayana Hrudayalaya? They said, no, nobody's treating us. In fact, our physician just told to go to Nara and the area because he was not able to treat the patient. I was just wondering, if this particular patient had used telemedicine to consult the doctor would have already known about this subject, about this problem, he could have really prepared the hospital, or probably, it may not be, it wouldn't have been necessary for the patient to really even go to the hospital, it's possible. But at 12 o'clock in the midnight, the whole family, with so much of money spent, leaving their jobs, they've come to Bangalore for this treatment. So this could have been really solved if there was a telemedicine setup, if telehealth was really implemented in those areas. Towards creating a healthy nation, ICT in health, especially in India, has to be implemented. We don't have a choice, it's imperative. Uh, the accessibility and affordability can only come through this technology. And in teleradiology solutions, this is a mini world of the entire ICT space that we are dealing with. We are dealing with telehealth in a big way. We are actually, as Dr. Arjun said, we are already consulting, giving specialist care to people in the remote areas, not just India, but also African countries. We are doing telepathology, whereas when pathologies are not available in remote areas, we are doing telepathology, we are doing teleradiology, we are doing telepsychiatry. So actually speaking, a teleradiology solution is already implementing this program in a much, I would say it's a mini world of all the systems and technologies that probably we can think of and talk today. And what is required today is to intensify the campaign, probably increase the number of consultations that we do, reach out to more people, reach out to the communities, reach out to doctors, create that awareness. Quality of care basically comes through adherence of standards. Right now today, if you look at the Indian healthcare system, the lack of standards is one of the major problems. Actually, there is no accountability sometimes. So a system that is data driven is will be important in terms of putting that standard in place. A little brief about analytics and decision support system. Basically, they all need data. These systems basically thrive on data, and without data, this is of no use. These systems can really enhance the quality of care in terms of warning, alerts, and also giving a proper treatment protocol and things like that. So, unless the system is driven by information and data, these other things are not possible. Most importantly, the cost of healthcare is really growing very high with every passing year, and that could also be brought down. There are direct costs, there are indirect costs. For example, I was talking about this case, the person who came from Assam all the way to Bangalore, the whole lot of cost that will never be counted as a healthcare cost, but it is costing him aircraft fares, accommodation, he's losing his salaries, jobs, whatever. Apart from that, evidence-based medicine will also help bring down the cost of healthcare drastically, and that is what is important today because majority of our population is below poverty line, and they all need quality care. Medical education, ICT is very important because you have live cases, you have data to share, you can educate doctors, technicians, and also create a lot of awareness among the patient, among the communities, among the people, so that they can, be more aware of what is happening to them, what is happening to their health, what they can do to prevent any further damage. So with this, I think I conclude my talk. I think it is not now today we don't have a choice. Actually, it's imperative that we really go ahead and implement these systems in place and really pass the benefit to our population, to the country. Thanks a lot. Thank you.
Thank you, sir, for giving knowledge on healthcare. Now, I would like request Dr. Chavi to speak a few words on use of WhatsApp in healthcare.
I was asked to talk about WhatsApp in healthcare, and I thought that was a very light topic and it's very relevant because I think every single person in this room is very aware of using WhatsApp. And I'm sure if I ask you guys how many people here have actually contacted their doctors through WhatsApp, that should be a big number. So I see that every day I'm an internist. I practice internal medicine as a physician, and I use WhatsApp in an everyday setting and if you see, there are many aspects of healthcare which are actually going to be benefited by using WhatsApp, and that's education in medicine, diagnosis, treatment. Um, the way it works is, if in the past you've heard Dr. Kalyan Purkar and Ankita Puri talk about telepsych and teleradiology, telemedicine, Ravi mentioned. These are all different mediums of diagnosing, and that helps the treatment of patients in medicine. WhatsApp, it provides a no cost or $1 a year, no advertising, texting, and now an audio platform for its users worldwide. And a UN study proclaims out of the world's population of 7 billion, 6 billion actually have an access to mobile phone. That's a huge number. It's I think the easiest of the technologies which can be utilized. There are a few concerns which I will bring out down the road. Um, so what do we need? We need efficient, we need transparent, we need confidential, which is one of the most important aspects of healthcare delivery. A real-time multimedia information um, in the form of CT scans, angio reports, X-rays, imagings, like ultrasound, sent to patients, um, the caregivers, and the service providers. And I think WhatsApp is the quickest way that, in my personal experience, is the quickest way to do this. So the most important reason why I brought this up is that we definitely need secure networks, and the way we deliver it to the patient should be in a systematic, simple approach. And I've seen things that are sent to patients or caregivers in link, go into a second link or a third link. I really hope that very soon we're going to have um, text information through WhatsApp given by a systematic, simple approach without any additional links provided for that. Um, the data should be either deleted. So for security reasons, I as a physician wonder, is the data going to be saved onto the patient's phone? Can it be deleted immediately? Can it be stored in e-records? And I think all of this is slowly taking shape and form as we're learning how to use these mediums to provide information to our patients. Texting in WhatsApp is familiar, it's quick, it's simple, and I'm feeling literally replacing emails. In the people that we have here, how many easily use WhatsApp compared to emails? How many of you utilize WhatsApp more than emails? And it's more than about 60-70% of you, and I think it's going more. Similarly, for my own patients and clients that I work with, I get in the morning as I wake up by the time I sit in the car by 7:30, I've actually received easily every single day 20 WhatsApp of the previous night's temperature charts or the sugars in the previous days or the blood work report that came yesterday night. And by the time I reach my practice, which is I start at 8:30, I actually have everything streamlined. I reply to them, and I think WhatsApp has made really a physician or your accessibility to your own health, um, pretty easy. And it actually currently provides text, movies, video files, and has more than 500 million users already. And what I foresee is more trauma centers, emergencies, global experts using WhatsApp as a medium to provide real-time, transparent information to and from patients to caregivers or otherwise. So you could use it. I just wrote that point down to elaborate. Nutritionists. I give complex medical treatments
a patient walks in, has diabetes, blood pressure, has had a stroke, and what comes out on my prescription is extremely complex. How many times a day I want sugar tested, and how many blood works have to be done in the labs every few days. There's 10 medications in a day to be taken, how many times a day? And I feel that when they follow up with me or with my prescriptions through WhatsApp, I can go stepwise and actually make it very easy for them to take each point out of my complex prescription and simplify it. And mainly have been using WhatsApp for that. Now, nutritional diets, people with low literacy, even they are able to use guidelines through my guide and my prescription through WhatsApp. There were a few personal experiences as an internist. Is an ECG right here in our clinic, in the golden hour, which is actually we usually have 5 hours after chest pain starts or an active cardiac disease, in which the survival, or if we have interventions during that time, the survival is very high. And a message, ECG sent by WhatsApp to the cardiologist, treatment instituted in time, a life saved, X-ray sent to a pulmonologist, he diagnosed on spot, treatment instituted, skin bruises sent to a dermatologist, rashes, and they turn out to be HIV. And all this just happening through WhatsApp. It's an amazing medium, I think, for colleagues to all work together. We have groups. I myself am with a couple of groups of doctors, one from my medical school, from different fields. We are 60 plus on one group, and then I have it with a hospital setting where all the other specialists with the internists. We put in data, we get second opinions, and our treatment and diagnosis has become much more improved with that.
Just want to share this image on the topic.
Yeah, there you go. Sinus?
Yep.
Yes. So you look at that, and that comes right through. Beautiful, clear digital images. You can enlarge them right there and look at every detail, and amazing. So I had to bring WhatsApp and telemedicine together here, and I wanted to write what is the definition of telemedicine by WHO, and the delivery of healthcare services where distance is a critical factor by all healthcare professionals using information and communication technology for the exchange of valid information for diagnosis, treatment and prevention of diseases and injuries, research and evaluation, and for the continuing education of healthcare providers, all in the interest of advancing the health of individuals and their communities. So it brings out actually telemedicine, the definition by the WHO brings out everything together. And here in RxTX, and teleradiology, we are actually doing all of this. We have been working, in the past, we worked with 2 years with the government of Karnataka, and we've seen more than 9,000 patients for different specialities, for medicine in general, in deep interior rural villages of Maharashtra. We worked with the Tibetan colonies, we have worked with rural Karnataka, and we have provided specialists on our end and provided some quality care. We've also had a paper which is submitted by us in the World Telemedicine Society on this and all our work on this. We have teleradiology, which we provide to Arunachal Pradesh, and it's amazing what as a facility we have been able to achieve in telemedicine. WhatsApp also with its audio feature, and I'm sure very soon we'll have a video feature coming through, can have a doctor give advice to population which has no access to specialists in rural, which is a rural population, and the data like old prescriptions from the rural setting, diagnostic test reports, ECG, they can be sent via WhatsApp to the specialist in the urban setting, and the specialist reviews it at a remote location, provides his or her expert opinion. Uh, WhatsApp does make it very convenient because I think the usability and everybody being very familiar and comfortable with WhatsApp is what is going to get it much more utilized in the healthcare setting. So, okay, not only just to inaccessible population, but to busy professionals, corporates, whoever wants to save time and travel for their second opinions. I think this is going to be a very easy medium. So to conclude this, WhatsApp is a very, you all are very familiar with it, and it is the, I think, the easiest and the most approachable medium for healthcare at this time. Thank you.
Thank you, Doctor. Last but not the least, we request Mr. Firoz to enlighten our knowledge on cyber security.
Patient है 12:30.
No. Right. So I was asked to speak on cyber security or internet security today, and I thought instead of going into VPN connections and all those technical things, I thought I would speak something about cyber hygiene, right? Something that would take into consideration what you as an end user use on a daily basis. So, what is cyber hygiene? Now, what is hygiene? Anyone other than Ms. Barber? Right. So, WHO website defines it as hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. Right. So, how does this work in the cyber setting? You have cyber hygiene refers to the steps that computer users can take to improve their cyber security and better protect themselves online. Right. So it's about protecting your private your data, your your information and uh, your money and everything else. Now, why do we need it? Why do we need cyber hygiene? Today we are in a connected world, right? So, you, on the touch of your fingertips, you have everything. You connect to your banks, you connect to your groups on social media. You have your professional networks connected. You watch movies. You download a lot of applications. You have your emails, communications, shopping. So you have everything online today, and it's a lot of information that you put out on the net. You don't know where it's all going. You don't know what part of it is being stored. You don't know how it's being utilized. You don't know what's happening to all the data, right? So why do we need that? So we need cyber hygiene to protect your personal data, your privacy, your reputation. You need it to protect your online identity, your money. You need to protect your dear ones against inappropriate content on the internet. And the main thing is once you upload something out there, there's no delete button. You cannot actually delete it. It's still there somewhere. It could be in the backup of servers. It could be you post a picture on Facebook. Next thing you realize I shouldn't have done it, but by then somebody would have already shared it and it's all there. You cannot actually go back and say, I want to clean it up. It's very difficult. Even if you want to, it's going to be a long process, right? And I'm not going to go into the other applications of internet and things like that. I'm just focusing on social networking, banking, and e-commerce today. And it's being used for education and all other things, telemedicine, a lot of things. But I'm not going to do that. So, uh, how many of you heard of these terms? Fishing, farming, wishing, smishing. Any of you? Fishing, right? Okay, so those are just variants of the other things. Now here's the definition. Now, what is phishing? Phishing it attempts to fraudulently obtain sensitive information, right? It's somebody trying to put a bait and get information out from you. Now, how do they do that? They send you an email with a great offer. You click on it. Could probably be linked to your Facebook or something. They take you to a dummy Facebook page that looks just like a regular Facebook page. You put in your username and password, and they have it. Right? It could be a page that just looks like an ICICI Bank login page. You go over there, you put in, your user ID password is gone. Right? It could be things like that. It could be just uh, okay. A lot of companies get emails about the website is not safe and things like that. You need to do something more about it. You start responding to that. At some point in time, your website is just locked, and unless you pay them some money, and that's called like ransomware or something like that, you really don't get back your site. It's just down. So there are a lot of cases like that. Now, what is farming? Farming is just a variation of that where uh, these hackers or whoever, they just install some piece of code, some application they installed on your computer without you knowing it, and it's running over there to get your information. It could be in terms of keyloggers, where everything you type gets logged. It's all recorded, it's sent to them, right? So they have all the information that is required of that. It could be something that is just looking at your usage pattern and just sending it to some company that's using it for data mining. It could be that. Now, uh, some of the things is good. Like most of your phones have this GPS location service. So it's basically when you're at office, it knows that you're in office. When you're at home, it knows it you're at home. It just depends on like every time you connect to the internet, the new network, it just sees your location, sends it out, right? And your phone just adjusts to that setting. I mean, you could just set up your phone for being in silent mode from this time to this time, or if you're in this particular area, things like that can work. It's for good also, but there are a lot of things that actually just is in there to just get information that could be used against you, right? And now we have like wishing. Wishing is it's again it's again a type of phishing where voice is used. We in wishing stands for voice. The phone, they just call you. They call you. I'm calling from so and so bank. It's regarding your card ending with these numbers, and you have a terrific offer, or you have these points that's about to lapse, right? And you need to do something immediately. I'm connecting you to a IVRS, an automated uh, voice system, and you go over there and the messages play. It's just like the regular phone, right? You keep keying in your key, your pin, and things like that, and your information is there with them, and they can use it for whatever is required. So, and it's the same thing with SMS, right? You keep getting those messages about lottery in UK that you've won or whatever. Please never ever respond to those emails. Those messages or emails. It's never going to happen. No one has left a fortune for you anywhere. There's no lottery that you've won. It's as simple as that. There's another new thing that's come up. It's not new. It's relatively new, and that's honey trap. Right? What happens here? I was looking for destinations, and from a website I got this, which is very simple. Right? It just says that a contact is made through a website, email, a personal advertisement, or MSN, Yahoo, messengers, right? And then you just become friends, exchange personal information and photographs. Now, again, they would send you Facebook links and things like that, which is a fake identity. You would see pictures of someone, or the person who's made contact would be claiming that he's in UK, but most probably he's in Ghana, Nigeria. Right? That's where they are. Um, it's mostly these countries that all these things originate from. So you just become friends, exchanging personal information, photographs. You become hooked, believing what you're told. You become sorry, believing the hard love story. You want to help, so you send them money. You become hooked. You send some more money, and then you run out of money. You borrow, right? And then you realize that it's too late. You feel ashamed. And it can get worse than that, right? And this is actually happening in India, Bangalore, everywhere. It's very likely that someone you know is affected by that, but because of the stigma and things like that, nobody comes out with it. And it's people lose a lot of money on this. It's very much there. There are a lot of cases with the Bangalore City Police today, and it's happening. But so what do you do for that? You just anyone you don't know is not your friend on Facebook, on messengers, or anything. Uh, it's the same thing. A continuation of that. Steps for safety. Okay, on Facebook, you only friend people you know. Okay, related topic. You go to your profiles and set it so that it's your profile is only seen by your friends and not by your friends of friends. Right. So recently there was something where if you send it to friends of friends, your profile and your post actually can be seen by around 150,000 people, right? Though your group is 100 or something like that. Now, if you send it to friends of friends, it can be seen by 150,000 people, right? And so it could be some message that you're sending it to your group, but it's actually going to a lot more than that. Always create a good password, and especially for Facebook, LinkedIn, and things like that, use separate passwords. It's okay to use the same password for a lot of other applications that you have. That's not critical, but you know, places like this, because the chances of getting hacked is more, right? So you don't share your password, change your password on a regular basis. Share your personal information only with people and companies that need it. Okay, and if you're going to a browsing center, you're using someone else's computer or something, always use a password that's just for that. Change your password, immediately has to go out of that. You're on a safe setting again, a known setting, right? You always log out after you use, and always any website that you go to that you're actually logging in, make sure that you're using HTTPS, secure login, not the regular HTTP. And when you do that, if the site is good, you usually see a green color padlock over there. Okay, that says that it's safe and you can use it. Uh, Only download apps from sites you trust. Okay, and there'll be a lot of posts that your friends would post and things like that, and you keep liking it. It can actually have a lot of replication, political things, and there have been instances, right? So again, it's easy to actually hack a Facebook account. So it's possible for someone else's account to get hacked. You get a link on that, you click that, it affects your account also. So just stop using all this things unless there's something significant. You would see a lot of things that it's like someone is in urgent need of money for surgery and things like that. This boy is not well, 6 months old, whatever. Father doesn't have money. You keep seeing those things circulating, right? You never know if it's true or not. So you need to give money. You go to a place that where to be utilized well. You give money over there. Forget about passing on those messages. It's not going to help anyone. Okay. Sorry. Okay. Now, when it comes to e-commerce, banking, and things like that, wherever you're buying something, you always see, there are a lot of options for making the payment, right? So you always, if you see a payment gateway, like it connects to a bank and then it goes redirect somewhere, use that option. Never give your card details, the CVV code, the three number code that comes behind your card. Never give that out anywhere else. Your PIN number and your OTP is never. No other site would need it actually. You just have to give it directly. I mean, you just have to use a trusted payment gateway. It could be your bank. So from there, the link actually takes you to your banking website, right? Use things like that. And the other thing is about keyloggers that I had spoken earlier. So most of the banking sites actually gives you an option of using a virtual keyboard, right? So it's you don't have to type. You go over there, you click on those on the website. You see that virtual keyboard. Always use that. So that it's safer that way. And do not share your passwords, PIN, OTP with anyone. And if you get any calls or SMS or email from the bank, it's actually better to call the bank directly instead of replying to this. And use strong passwords, right? And on your computer, home computer, most of them would be having a pirated copy. It's not safe. Go with genuine software. Invest the money in that. It'll save you a lot of money in future. Okay. You also need to ensure that your OS and applications are updated regularly. You need to use a good antivirus software. It, Antivirus, it's not necessary to actually pay for it. You have free ones which are good. Okay, Avast for one. Uh, Anything that doesn't force you to buy after 15 days is good. Okay, so that's one thing. You also have a lot of uh, it's always good to actually consult someone who knows about it and get a free one if you don't want to again invest on antivirus. But antivirus and the firewalls today are very cheap. It comes for like 400, 500 rupees per user. So it's not a big deal. Okay, always enable user the firewalls. Okay, if it's possible, get the kids their own computer and lock it down, so they don't get go to sites that they're not supposed to. Okay, and also there are software that's available to actually monitor the activities on a computer. So you're giving your kids a computer, it's always good to install those so you can track what is happening. You don't have to stay, you don't have to watch from the shoulders. You can always track it at a later point in time. Okay, again, your financial transactions, right? Banking and things like that. Now, if you're using your computer for a lot of other things, right? It's always good to have a dedicated computer for your financial transaction. It doesn't mean that you actually have to have a separate computer. It just means that you can actually install a virtual machine on your computer and use it from there. Now, how do you install a virtual computer? There are a lot of software that's available which runs on your computer, and inside that you can actually run a complete Linux machine or a Windows machine, right? So you really don't have to invest on the hardware. When you do that, there's no cookies in there, there's no malware in that. You're using it only for accessing your banking sites or for your any e-commerce deals that you do. Okay. Now, strong passwords. It's very important. Now, how do you? I mean, if you look at this building, I'm sure that most of you know about 3 or 4 passwords that you go and you can access most of the system, right? And we've been trying to change that, but it's not possible. It's the same thing. You would also have the same password for all your websites, and it would be somebody's name and birth of date of birth combination or something like that. Now, how do you change that, right? It's very important to have a very strong password, at least 8 characters. You use a mix of letters, numbers, symbols, uppercase, lowercase, okay, and do not use dictionary words. Now, an example would be you just have a phrase and get the first letters of that. Right? My best friends in school were Amar Akbar and Anthony, and that converts into that. You can some of the alphabets you can just convert into numbers, like B becomes 6, I becomes 1, and things like that. So it's very difficult to crack something like that than a dictionary word. That's it. Any questions?
Any questions? Thank you so much for your precious knowledge. Here we have small mementos for our speakers. I request Ms. Marian to give this mementos. Thank you, Ms. Marian. Thank you, Ms. Kavita. As everything comes to an end, now I would request to call upon Ms. Deepika Bedi to present the vote of thanks.
Distinguished speakers, Dr. Arjun Kalyanpur, dear colleagues and guests, a very good afternoon to all of you. I'm sure you're not hungry, so I'm not going to keep you here for too long. It is my honor and privilege to be able to personally thank all of you today for coming here and participating and supporting this wonderful age of digital world. What is more exciting than having 2 major parts of the world, the US and India, take this concept by its horns and implement it in ways of their own in their own countries. President Obama with his meaningful use and Prime Minister Modi with Digital India are doing what we have been doing for the last 13 years, serving the people digitally, or in other words, bringing healthcare to the people by means of digital and electronic. TRS has been providing teleradiology and ETJ. Telerad Tech has been providing technology to allow us to do this. Healthy Minds is providing e-health in the mental health care industry, RxDX in the form of telemedicine, and ICL in the form of research. Dr. Kalyanpur, as he said in his speech, we are the forefront, our group of companies are the forefront in the digital world and in bringing the services, research, and education out to the people. Benu mentioned healthcare, which means no digitally again, which means no longer carrying diagnostic films from one doctor to another, having to wait for weeks for appointments with specialists. Doctors don't have to go to clinics to meet with their colleagues, to do a second opinion, to discuss cases with their colleagues. Everything is available to them at their desks or their homes, which not only saves time and makes it easier, but is also much more efficient. Ankita talked about what Healthy Minds does and how it tackles the issues of, mental health. How they use technology not only to provide benefits and costs, but also to address the issues of confidentiality, stigma, etc. Ravi discussed the various means of health ICT, how and why we need ICT in our lives, especially the benefits of connecting specialists to the patients and providing quality healthcare to the poor. Dr. Chavi opened our eyes to WhatsApp and how WhatsApp is used not only in the social media but also in the health industry. How patients can discuss with their doctors how it is documented for patients to refer to later, and there is no means of miscommunication. They can, not when you listen to things, you can always mishear. Prime Minister Modi, in his speech, in his inaugural speech the other day, discussed cybersecurity, or rather lack of it. And Firoz discussed the same, and he called it cyber hygiene in his presentation today. It's a very scary world out there, and how we can protect ourselves, protect our families from this hacking. As Marion mentioned in her opening remarks, let us look at ourselves and see how we can join these speakers today and others in the world in making people and the entire world digitally connected, so each and everyone has access and benefits from these services that otherwise would not have been possible. I would like to thank the distinguished speakers for doing what they're doing today and for coming here and sharing their thoughts with us. My sincere thanks to Dr. Arjun Kalyanpur also for cutting his trip short and coming and dressing the gathering today. My special thanks to everyone who helped put this event together, especially the project team, the maintenance team, the IT team, HR and the admin team, and of course, Michael and the housekeeping team. I finally would like to thank all of you, our wonderful audience, for coming today. You have taken the first step towards participating in Digital India and digital health growth. Let us now spread the word and do our part in helping succeed the thoughts of our leaders. Thank you.
Thank you everyone for coming and making this inaugural ceremony a success. Have a nice day.
Selfie.
ಅಲ್ಲ ನಮ್ಮ ಮೊದಲೇ ಹೇಳಲ್ಲ ಎಸ್ ಟಿ ಪಿ ಇಂಡಿಯಾ
ನಾನು ಎಸ್ ಪಿ ಇಂಡಿಯಾದಲ್ಲಿ ಕೊಟ್ಟು ಕಳಿಸಿದ್ದೀನಿ ಎಲ್ಲ
ಹುಡುಕಿದೆ
ಮಾಡಿದ್ದೀನಿ.
ನಿನ್ನೆ ಮೇಲು
ಎಲ್ಲಿ
ಸಿಗ್ಲೇ
ವಿನ್ಸುಗೂ ಕೊಟ್ಟಿದ್ದೀನಿ, ಎಲ್ರಿಗೂ ಕೊಟ್ಟಿದ್ದೀನಿ. ಎನಿವೆ ನಾವಾದ್ರೂ ಹಾಕ್ಬೋದಲ್ಲ. Personal information, especially Dr. Chavi.